name is Shasha.
And my name is Adila.
Hi, my name is Anina.
Hi, my name is Muhammad Iskandar from S09, and today we will talk about type 1 diabetes mellitus.
Diabetes is a chronic disease occurs either when your pancreas does not produce enough insulin or when your body is not effectively use the insulin it produces. Many people misunderstand about this disease. Diabetes can only be infected when passes down through generation. For example, if someone inherited diabetes from their mother, father or grandparents, that person is called carrier. If one of you inherited diabetes, don't worry about it because it's not dangerous if it's not active. Diabetes is one of the famous non-communicable diseases occurs in Malaysia. The question is, why it is very famous? Well, according to the Malaysian National Diabetes Registry Record 2020, there was a total around 1,700,000 patients inherited diabetes have been recorded. And among them, there were around 900,000 patients with active diabetes in 2020. Based on Table 1, there were around 876 clinics head under Ministry of Health from all states in Malaysia have submitted data to the National Diabetes Record in 2020. Referring to Table 2, we can see the characteristic of patients registered in NDR in 2020. Based on result, we can conclude that most sex with diabetes in Malaysia is female with 57.02%. Other than that, most ethnic that inherited diabetes is Malay with 59.35%, followed by Chinese with 19.42% and Indian with 12.98%. Last but not least, age between 50 to 54 have highest age group with diabetes that has been recorded in 2020 with a total around 219,000 patients.
Type 1 diabetes is a lifelong chronic autoimmune disease that prevents the pancreas from making the insulin. So, what is insulin? Insulin is an important hormone to regulate the amount of glucose in our blood. People that do not have enough insulin, it will cause too much glucose in their blood. This will cause hyperglycemia, which is high blood sugar. That means our body cannot convert the food that we eat into energy. This will lead to serious illness that probably will lead to death if it's not treated early. Type 1 diabetes needs synthetic insulin in order to stay alive and be healthy. Type 1 diabetes, also previously known as juvenile diabetes and insulin-dependent diabetes. Anyone at any age can develop diabetes type 1, but commonly, the ages that is being diagnosed is between 4 years old to 6 years old, and around the early puberty, which is 10 to 14 years old. In addition, you don't have to have a family member that have diabetes type 1 to develop this condition. But with having a first-degree family member, it will increase the risk to develop it. Type 1 diabetes is less common than type 2 diabetes. Around 5 to 10% people that have diabetes is actually type 1 diabetes.
So we are moving to the causes of type 1 diabetes mellitus. Basically, type 1 diabetes mellitus are caused from the autoimmune reaction. Autoimmune reaction is the reaction which our immune system will attack or destroy the cell that produces insulin, which is beta cell. This process will go for a month or maybe a year, even the symptom does not appear yet. If your mother, maybe your father will disease this type 1 diabetes mellitus, you have the risk that inherit the certain gene that more likely to develop type 1 diabetes mellitus. However, many of people doesn't go for type 1 diabetes mellitus even if they have those genes. Triggering factors such as virus from environment also play a part as developing the type 1 diabetes mellitus. For the factors such as diet or lifestyle balance will not the cause of type 1 diabetes mellitus. So we'll move to the common symptom or sign that you're having the type 1 diabetes mellitus. First, you can feel unusual thirst. This is due to the lack of insulin in your body. This will causes builds up in excessive glucose in your bloodstream. So to move up this excessive glucose, your kidney will work hard to move as much as many this excessive glucose from your body. So this will also pull up your water from your tissue that causes loosening water. As a result, you can feel very thirsty. Second, you can feel the frequent urination. When the excessive glucose moves up from your body, that organ which is kidney move up this excessive glucose, your urine will also take along with the excessive glucose. So this will cause the frequent urination occur. Third, you can feel the sudden losing of weight. When the build up of excessive glucose happen to your body due to the lack of insulin, this will make the cell can absorb the glucose to your cell because the excessive glucose builds up in your bloodstream. So when your cells doesn't have this glucose, your body will think that it's starving and need to think the solution to overcome this situation. So your body will create the energy to burning the fat and muscle rapidly. As a result, you can feel the sudden losing of weight. For the last point, which is the quick change of vision and fatigue. Change of vision is related with the high glucose level. When your body has the high glucose level, your eyes will swelling that it will disrupt your clear vision. For fatigue, you can feel the tiredness that comes from your body cannot absorb the sugar to produce energy. It will suffer our lack of motivation and also tiredness.
Okay, now moving on, we are going to look at the type 1 diabetes treatments. So, for people who has type 1 diabetes, they have to take insulin shots, do regular blood sugar checks, and being physically active and do carbohydrate counting. So, the patient with type 1 diabetes need to take insulin shots every day because insulin is needed to maintain their blood sugar levels and give them energy. Insulin can't take as a pill because it will get destroyed in your stomach before it could reach into your bloodstream. Okay, second, patient who has type 1 diabetes have to do regular blood sugar checks. The reason is because maintaining a healthy blood sugar range will avoid any health complications. So, blood sugar checks can be done by using blood glucose meter. Fourth, patient who has type 1 diabetes need to do carbohydrate counting. The reason is because carbohydrate is a macronutrient that can be found in our foods or drinks. So our body will digest the carbohydrates and turns into glucose. So it will increase our blood sugar levels. So by that, patient who has type 1 diabetes have to take insulin shots to maintain their blood sugar levels, and carbs counting is a basic things to do to count carbohydrates per gram and match it into the doses of insulin needed to overcome the sugar.
Hi Anina, how are you?
I feel very better.
Oh, what's wrong?
I always feel very thirsty and I usually go back and forth to the toilet. For the past few months, I had sudden increase of weight for a few kilos, and I usually lack of motivation and tired for the past few days.
I see. Okay, so I'll do blood sugar test on you to check the amount of sugar in your blood. If the result shows that the amount of sugar is too high, then you have diabetes. Then I'll do an antibody test on you. This blood test checks for autoantibodies to determine if you have type 1 or type 2 diabetes. Autoantibodies are protein that attack your body tissue by mistake. So basically, if these autoantibodies are present, that means you have type 1 diabetes.